So, stroke. In this video, we are going to talk about stroke, epidemiology, pathophysiology of stroke and types of stroke. So, stroke, in the other word, cerebrovascular accident. It occurs due to the restricted blood supply to the brain. It causes cell damage and impaired neurological function. Now, clinically, a variety of deficits can be seen in stroke, mainly motor, sensory, language, perception, and mental functions are impaired. Now, if we talk about the motor deficits, so that are characterized by paralysis, that is, in other words, hemiplegia or weakness, other words, hemiparesis, on the side of the body, opposite to the side of the brain insult or a cerebral infarction. Now, exact location in the brain and the extent of the lesion defines the neurological picture of the patient. Now we see the epidemiology. Stroke affects men more than women. Stroke is more predominant in blacks compared to white people. According to CDC, Center for Disease Control, in the year 2020, 1 in 6 deaths occurred due to the stroke in patients with cardiovascular disease. According to CDC, in United States, every 40 seconds someone diagnosed with stroke, and every 3.5 minutes someone dies because of stroke. Now, if we see the types of stroke, 87% of the stroke patients are due to the ischemic stroke or the cerebral thrombus, where the blood flow to the brain is blocked. Now, we'll see the pathophysiology. There are a number of mechanisms which results in a vascular insufficiency to the neural tissue, which results in stroke. But the most common causes are number 1, thrombus or cerebral thrombosis, where 87% of the patients. Second most common is embolism or cerebral embolism. Third is a hemorrhage. Hemorrhage is secondary to the aneurysm. Now, less common causes for stroke includes tumor, abscess, and inflammation processes due to arthritis and trauma. Atherosclerosis is a major contributing factor in occlusive vascular disease, producing plaque formation that causes a progressive narrowing in the cerebral vessels. Now we'll see the cerebral thrombosis or thrombotic stroke. Cerebral thrombosis refers to the formation of blood clot or thrombus inside the cerebral arteries, the arteries in the brain. Thrombi results from platelet adhesion or aggregation, coagulation of fibrin, or increased fibrinolysis. Now, thrombus in extracranial vessels or the arteries can also produce the same symptoms of stroke. Name a few: carotid artery, vertebral artery. Thrombi lead to ischemia to the neighboring neural tissues or occlusion of the artery that results in a cerebral infarction or tissue death. And in other words, arteriothrombotic brain infarction, ABI. Now we'll see the cerebral embolism. What is embolism? If a thrombus gets detached from its original site, it becomes embolus or emboli. Traveling bits of matter that is called as an embolism, such as thrombi, tissue fat, air, bacteria, or even the foreign bodies, which are released into the bloodstream and travel to the cerebral arteries, producing occlusion or infarction. Commonly associated with the cardiovascular disease, valvular disease, myocardial infarction, arrhythmias, and even the congenital heart disease. Systemic disease that produce septic, fat, or air emboli. Now we'll see the third type of stroke, that is the hemorrhagic stroke. Hemorrhage, we have bleeding outside the body and inside the body too. That is called as a hemorrhage. Now hemorrhage occurs from, as I said, abnormal bleeding owing to the rupture of a blood vessel inside the brain. Intracerebral hemorrhage is caused by rupture of cerebral vessels with subsequent bleeding into the brain. Now what happens? Tissue death occurs from increased pressure, increased intracranial pressure resulting from a clot formation and restriction of a blood supply that is distal to the neural tissues. Now we'll see the subarachnoid hemorrhage. So brain in a spinal cord has 3 layers of covering. The outermost is dura, the middle is arachnoid, and the third is a pia mater. Now, what is subarachnoid hemorrhage? Occurs from bleeding inside the subarachnoid space down to the arachnoid. It may be spontaneous and secondary to intracerebral hemorrhage or trauma, rupture or even the rupture of Berry aneurysm, or due to the arteriovenous malformation. Hypertension, increased pressure can be a precipitating factor, and vessel that is affected are often weakened by atherosclerosis. So first, the cerebral arteries are weakened by atherosclerosis, and increased pressure, hypertension lead to subarachnoid hemorrhage too. Massive cerebral bleeding lead to rapid increase in intracranial pressure, and it compress or even displace the adjacent neural tissues or the cortical structures. Now in stroke, there is a good acronym according to the CDC, Center for Disease Control, is B FAST. Now B stands for balance. If a patient is wobbly or loss of balance. E stands for eyes, when patient has a sudden loss of vision in one of the eyes. F stands for a facial asymmetry, where one of the facial muscles are weak and the other are normal. A stands for arm. Ask the patient to raise the arm on the affected side. Patient cannot do that. S stands for speech, slurry speech, or patient speaks something that you cannot understand. And T stands for time, where every second counts. So move the patient to the nearest hospital. Thank you.